Hi, my name is Peter. I'm an RN. I've been an RN for a few years. I wouldn't consider myself an expert yet. I'm still like new. I feel like I'm just a new grad. Because I still have a lot to learn. There's still a lot of things that I don't know what to do. I work on a Tele stroke unit, PCU unit. So I have all kinds of patients. I just kind of want to share my story. This is like a journal for me. Instead of writing, I'm just talking. Alright, so the patient I had, this guy, he's about 70 years old, male. He came in for fever, chills for a couple days. They diagnosed him with UTI, infection, sepsis actually. Apparently he was admitted a week ago for the same problem, the UTI, and then they also placed a left ureter stent in him. They discharged him, gave him some antibiotics, sent him home. Now he's back again with infections, fevers and chills. History-wise, he has a pacemaker, high blood pressure, DVT in the past, recurrent UTIs, hypertension, obstructive sleep apnea, and apparently he had a motorcycle accident a few years ago where his T7 is damaged. He has paraplegia. On top of that, neurogenic bladder, so he has to do a straight cath himself. But then he told me they did some kind of procedure on his back a while back, and since then he's now contracted. His fingers are like this, so he can't really do the straight cath himself anymore. He told me his wife has been doing it, his daughter has been doing it, his son, his friend. I was like, that's a lot of people, maybe the reason why he keeps having UTI is because there are so many people helping him and they're probably not doing it sterilely. He's a pretty pleasant guy. When I received the report from the night shift nurse, he told me this guy has an order for straight cath every 4 hours and as needed. I looked at the charting. The nurse only did 2 straight cath. I was like, wow, that's not too bad at all for a 12-hour shift. Apparently I was wrong. Throughout my shift, he was asking for the straight cath like every 2 hours. So the total numbers of straight cath I had to do was 6 times. I think it's because he also has fluids running at 100 cc an hour. And at night, I guess he was sleeping most of the time, so he didn't ask for it. He told me he still feel the urge when he needs to urinate, and if he waits too long, he's gonna have an accident, and he doesn't like that. I told him, we can clean him up if I can't come on time and stuff. He told me he doesn't like that. Around 7:15, when I was still getting reports, he already called for me. He was like, oh hey, I need a straight cath right now. I have an urge. I told him, I gotta finish getting report and then I'll come back as soon as possible. Well, that day I had a student, so I only demonstrated the first straight cath, and then she did the rest. So, she was really helpful. She told me the number of straight caths that she did for that day was more than 2 of her clinicals combined. So I thought that was cool. At least she learned something. This guy also has MRSA. He's positive for MRSA in the perineum and neris. So it took a lot of time, every time we go in there, gown up, gown out. Tele-wise, he was sinus ridden with PAC, so nothing was going on. He didn't want to take Tylenol when his fever was like 100.2 degree Fahrenheit. So I kind of gave him an ice pack for his forehead and armpits. He didn't want a Tylenol because he told me he's taking a lot of medications. He actually has about 10 to 15 medications, including antibiotics, for the whole shift. The plan for this guy is the next day he's supposed to have, I think it was a cystoscopy. They're supposed to go in there and check it out. They might replace or fix the stent. So I told you how he's pretty pleasant, right? But one thing that surprised me during my shift was, I think about halfway through, he called me in and he was like, I don't want to see that guy anymore. He was rude, and the way he talked to me he gave me an attitude. I kind of had an idea who he was talking about, because that guy also told me that, the patient needs you. His IV came off, this patient, he was like, yeah, that guy was rude. He he walked past by and I called for help, and he was, you know, yelling at me, and the way he spoke to me was like, was just not pleasant. I know that staff, you know, I don't think he meant it like that. I think that's just the way he talks, and I don't know, I guess the patient couldn't see his face, so he thought he was yelling because he kind of stood outside the door. After the patient told me that, I kind of, you know, be more careful when I approach the patient. I guess I try not to stand outside and talk to the patient because he might take it the wrong way. And I hope, you know, future nurses, you know, whoever has patients like this should be more careful, you know. Anyways, that's all I have for now. Maybe I'll do another one if I find another patient who's interesting, you know, or if I had an interesting day or something like that. I mean, if a lot of people want to hear more stories, then I'll do more. But if not, then, you know, I'm just doing this for fun, I guess. Anyway, peace!